This was a more complex study, a 3-arm study. They allowed 2 different versions of paclitaxel. One was a regular Taxol, and the other one was the NAB paclitaxel, which is the albumin-bound paclitaxel, was one of the arms. And then we had the placebo arm. And what we saw there, again, was, the primary endpoints were overall survival and progression-free survival. There was a definite benefit in terms of progression-free survival. And the overall survival, they haven't completed the analysis. We only have the data from the first interim analysis. And what we saw was it did not show a significant difference in overall survival. But it remains to be seen what the subsequent analysis will show. And interestingly, what we did find was at the 1-year interval, 1-year survival was not significantly different between these 2 arms. But as we went further in time, and the 2-year survival seemed to show a separation between the curves. And so what that study, at least at present, tells us is there is definitely a group of patients in this population that are benefiting from the chemotherapy plus immunotherapy arm. And who these patients are and how best we select them and deliver the appropriate treatment to them is, I think, the key issue that we will probably know better once the final results of that study is out. And of course, with the Keynote 407 already showing that all the patients in that study who were on the pembrolizumab plus chemotherapy arm, not all the patients, but in general, patients on chemotherapy plus pembrolizumab had a significant advantage. And so probably that may be the standard of care going forward. Whether this combination also becomes a standard of care will depend upon the final overall survival data.